deadly, depressive, financial burden, or it may be because of my karma. Those were the nightmares faced by my relative when she was diagnosed with cancer. And that makes us think that how these experiences can affect the treatment compliance of these patients. Me and my team, affiliated to SSR Medical College Mauritius, conducted this study. To begin with, I'll be talking about introduction, material and methods used, results, discussion, limitations, and the conclusion of the study. According to National Cancer Institute, cancer is defined as an abnormal growth of cell that is uncontrollable, which has an ability to invade any part of body. And WHO has reported it as the second most common cause of death worldwide. In fact, every year, 9.6 million deaths occur due to cancer. Talking about the cancer burden, it is increasing rapidly. In fact, the patients go through physical, emotional, and financial constraints. They go through various hardships. Psycho-oncologists have classified it into three phases. Phase 1 of initiation of shock, phase 2 of disbelief, and phase 3 distress and adjustment. If we can improvise these cancer care, then we can increase the treatment compliance of these patients. This study was conducted in the oncology department of Candos Hospital, Mauritius, which was from August to September 2019. Ethics Committee of Candos Hospital and the Institutional Committee of SSR Medical College approved this study under the Calcott principle prior to the study. And while the interview declaration of Helsinki ethical principle of medical research of human subjects was followed. The questionnaire was designed on extensive literature review and a pilot study, which was semi-structured and open-ended. There were two inclusion criteria. One was based on purposive sampling for diversification of data in terms of age, types of cancer, and the economical factors. And patient must have gone through at least one chemotherapy prior to the interview. The only exclusion criteria was severely ill patients. The sample size calculation was based on the guidelines of Glasser and BG, and data was collected until saturation and there were no codes generated. Considering the results now, the result was voluntary participation of 12 patients, 5 males, 7 females, and the average age was 48.2 years, ranging from 22 to 70 years. With the help of Nevo software, we did the statistical analysis based on Braun and Class 6 phases of thematic analysis. Results was 7 themes were generated. First, motivational influences. Second, in psychological factors. Third, role of community. Fourth, message for others. Fifth, disease awareness. Sixth, economic factors. And last, perception towards the healthcare environment. Now, moving ahead with the discussion, we have 7 themes. The first one was motivation influences. The two main codes that were generated was faith in God and willpower. These two main codes help the patient to be motivated and to be compliant with the treatment, irrespective of the environment they were living in. Now, another theme was psychological factors that may be due to acceptance, denial, or irritation of the disease, or it may be due to the emotional turmoil the patient was going through, and that deviated the patient away from the treatment. Talking about the role of community, family support, support of relatives, supports of their children, help the patient to cope up with the treatment. In fact, a lot of patients even reported that they understood the reality of society. Some patients were not even aware of the diseases and what are the treatment options of the cancer they were going through. In fact, some patients even blame the genetics of their family for getting them diagnosed with cancer. So these factors showed us that lack of awareness was present in the society and the stigma that cancer carries around. Another important factor was economic factors, the hardship experiences by the cancer patient. There was a study conducted by Mesothelioma Center in 2019, which reported paying bills, struggling to buy food, avoiding doctor's appointment, losing doses of prescription, or lowering the doses of prescription, skipping the treatments. And this was correlated with the economical status of the patient. Some patients had life insurances and some patients had a very low family income. And because of that, they had different compliances with the treatment. Now, talking about the most important pillar of this research was the role of healthcare environment or the perception towards the healthcare workers. Now, the healthcare workers involve the nurses, the healthcare staff that are present, the clinical pharmacists, or the treating oncologists. Apart from that, there was a research that was published in 2016 that the old paradigm involved the physician and the patient, but according to the new paradigm that involves primary healthcare providers, oncology nurses, clinical pharmacists, social workers, and the caregiver, which revolve around the patient and forming a better treatment compliance for the patient. There have been several researches which have been supporting this, but with that, I want to quote narrative from one of my patients that how they were helpful and they motivate the patient a lot for the treatment. In fact, some studies have also suggested that pharmacist is a bridge between doctors and patients because they help in understanding the side effects. A study conducted by Ma and C that the presence of clinical pharmacists could aid the patients to better comprehend the side effects, drug reviews, thereby aiding the patient in sustaining therapy, thus decreasing the burden of treating oncologists. So that was a very important point because these days we are facing physician burnout, and that could help the oncologists to focus on more patients, and pharmacists could help the doctors, the treating oncologists in managing the patient. Considering the limitations, first limitation was that it was a unicentric study. Secondly, the religious beliefs were not considered. And third, the interviews were taking of those patients, those who are undergoing treatment. And the final one, the perception of family and relatives were not considered in this research. Now, as a conclusion, firstly, the lateral thinking skills of the healthcare professionals was very important because they help the patient to comply with the treatment as they manage the patient very well. Now, the second important thing that has to be focused was caregivers positivity. Caregivers positivity help the patient to cope up with the treatment and comply, and the caregivers support help the patient to move ahead with the treatment. And the key point of this research, involvement of the healthcare and clinical pharmacists could improve treatment compliance. So thank you all for being so attentive. And if you have any queries regarding the research, you can mail me on my email. Thank you.